Hey guys, it's me again. We're going to do another before and after. Now we have someone with wrist pain. Your right wrist bothers you. So tell me just a little bit about what's going on with your wrist.
So I've had tendonitis for several years, and I need to do yoga to keep my back in check, and that helps, but it's hard with the wrist. So it doesn't go back all the way, and I can't put pressure on it, so I can't do the planks and the push-ups and that kind of position and the downward dog, all of that. It just makes it really difficult. I can just do it for a much shorter amount of time and hold it, and then the pain comes in. Also chopping vegetables and using my hands, just it just gets really tight and sore, and I can't vacuum because that sort of in and out, it's like too much. But it's just in this right wrist here, and I've done a lot. I've done the physical therapy, even went as far maybe I think 10 years ago to do radiation, and I do these stretches that help, but it doesn't go away. So
Yeah.
anytime I'm like doing the type of thing that I want to be doing, which is like exercising on the floor, push-ups, that type of thing, yoga, it flares.
Okay, so what we know for sure is that there has to be something else going on with this. There has to be something else going on. So we're going to go a little deeper. And so I have a question. Um, do you have digestive problems?
Yes, I do have a history of that. I'm on it with diet, but I know that there's still some lingering issues. I'm really in control of it with diet and probiotics, but there is still some lingering issues. So definitely yes.
Okay. Okay, so the first thing I'm going to do is I'm going to do a little before because it doesn't really hurt when she doesn't move it. It's like when she moves it or activates it. So go ahead and try to like do like a little push up or resistance and tell me
Right.
if you feel something.
Yeah, so I mean, if I put my weight on it, I'll definitely just like a push-up position. So you can see it won't go as far as this hand in terms of the angle, um,
Hmm.
and then it just begins to feel like it's going to give way.
Yeah, it's kind of like a weakness.
Yes, it's
Okay,
definitely very, very
so
weak.
unstable weakness.
Unstable, weak, and yeah, unstable, weak, and very tender and painful. Yeah.
Okay, so what we want to do is we want to rate that 10 being fully strong, 0 being completely weak. Give me a number.
Um, I would say 6.
Okay, so what we want to do is we want to isolate it. Now, the first thing I'm going to check before I do anything is the gallbladder. Why? Because the gallbladder is a source of a lot of problems. It creates a nerve that goes up to the nerves of the neck, which happen to connect to the hand. I've had people come in with splints on the hand, the thumb, the fingers, and they're like, oh, what's wrong? They get therapy, nothing happens. So let's just see if the gallbladder is involved. I'm going to do a little tiny little test. So I'm going to have you lay on your back with your head over here. So if you've watched some of my other videos, you probably see that there's a lot of hidden pain syndromes from gallbladder. So I'm just going to kind of gently kind of stimulate the flow of the gallbladder so it can drain a little bit. And tell me if is that sore?
A little bit.
Yeah, right there. Yeah, again, I'm not pressing on the gallbladder, the soft tissue around the gallbladder, which is connected to the gallbladder. And you can even do this to yourself. You work on this little area right here. You find out where the tenderness is. Yeah, right there. Good morning. And I'm just going to hold this for about an hour. No, I'm just kidding. I'm doing this for about 2 minutes here and pressing up into this area right here. So the next thing we'll do is just compare. So now let's have her sit up. Let's have you sit up right here. And then go ahead and do the same thing you did before. And let's just compare. It was a 6. Tell me what's going on now.
Feels a little bit more flexible.
Mm-hmm. How about the stability factor? Or the strength? It was a 6. What is it now?
um, Yeah, it definitely does feel stronger. The pain is still there, but it's definitely like I feel a little bit of pain in the wrist, but
Mm-hmm.
it feels a little bit more stable and a little bit more like it's bending. Is that bending 90 degrees?
It looks like it.
Yeah, because it doesn't usually go as far as this one. So it does. Wow, yeah.
Cool. Now let's have you lay back again. I want to just check something. Okay, so now what I'm going to do is I'm going to come in here a little bit more into the liver area right through in here. Now, she did tell me she did kind of go off her eating for a little bit, and there's some insulin resistance. So there's a little bit of a blood sugar thing. What I'm going to advise, and I'm going to show you, one of the challenges when you do the eating plan is you add more fat, which is hard to digest if there's the gallbladder issue. So I'm going to recommend, as a simple no-brainer, is some apple cider vinegar plus. Are you taking that?
No.
That is an acidifier for your stomach that will release her own bile. So when she takes it before a meal, like 4 before a meal, the stomach will release bile. It'll digest so much better. It'll take the pressure off this gallbladder, and it'll make it easier to stick to the program, and it improves insulin resistance, and it'll help the gallbladder, and I think that pain thing will go away, especially if it's related to the digestion. So we talked before this, and we were like, okay, how do we completely fix this? Well, once we find what's causing it, by what we're doing now, we're testing something, see what gets a fast change, and then we're going to focus on the gallbladder, improving the digestion. That's what we want to do. Like, keep your diet and keep these other things. Yeah, and then really help the digestion, and that's going to fully resolve this issue with the hand, because like it affects your writing. You're a teacher, and this whole thing. So now I'm going to come a little lower. Yeah. So now we're right on the heart of it, right through in there.
So is that like gallstones, or what is it that's
No,
sore?
I think she asked, is it gallstones? I think it's just a sluggish gallbladder, and there's a little duct there that you drain stuff out. That's a little congested, and that comes from eating poorly sometimes in your past. You have a history of eating poorly?
Yeah, I mean, I changed my diet about 7 years ago.
What about before that?
Before that, it was very high carb, very high crackers and white rice.
High
and
carb,
pasta.
crackers, pasta. Join the club. I was there for 28 years, so I know what you're talking about. So now let's just recheck it. Okay, go ahead and do that same thing again.
Yeah, it feels very similar to this one, to the left one, and it still feels a little bit of pain, but it definitely does feel more stable and less weak and less and more able to bend 90 degrees, which I've never been able to bend 90 degrees. So, but it does. I still feel a little bit of pain.
Okay.
It's not as easy to do it as this one, but it's definitely. I'm just feeling more stable in it, which is weird. I usually feel like it's going to give way.
Awesome. So
So.
sit right here. So the other thing you do for wrist pain is you work on the opposite side. So we'll take this side, and we'll just go into the muscle through here. And when you press on if it hurts on the wrist, like it hurts right here, then you work on the muscles connected to the wrist, but on the opposite side, right through in here. And this will be a little bit sore as you work this out, but that's how you kind of get rid of that pain component, because it's been compensating. You probably support this side, and you put more pressure on this side as you work out.
Right. Absolutely.
Like right here, this thing.
Yes. And I have these weird bumps that they look like all over my hands, actually, my arms, up until my elbow area.
So let's look at those
These
bumps
are
in a
weird.
second. I want to just, okay, so now go ahead and just retest the same thing. Now tell me what's happening with the pain.
The pain is still there. It's a little bit less, but again, feeling stable, feeling, yeah. I mean, because I've never been able to bend it 90 degrees, so it feels like it's doing it, and it feels stable. But there's a little bit of pain, not much, but there's definitely pain here and here. Here maybe because it's stretching farther than it's been stretched in a very long time, so that's the pain here. But the pain that's there, is it's less, but it's still there, but it's definitely less, and it feels more stable.
Awesome. So this is because it's coming from the digestion. We just have to work more on the digestion because this is the symptom and this is the cause. So it's just a matter of getting this. Once this is better, the pain will probably completely go away. Probably have to work a little bit on here, but your problem is not in your wrist. And that's why the physical therapy did not work, because they put radiation in your wrist.
Yeah.
Okay, now, so that's cool. Are you happy with that?
Yeah.
Okay, good. So now show me those bumps.
Okay, so you can. I don't know if you can see it. It's a little bit blue, but you can feel it.
Yeah.
Do you feel how it's
Yeah.
bumpy? And I have them all around my elbows, and nobody has been able to tell me what they're. They wanted to have them biopsied, and I was a little bit scared to do that. But so I have that, and I have them all up, and you can see my rashes probably from my liver. But I have them here.
So here's the thing. These are like little tiny,
Almost like
little,
varicose veins.
they're kind of like little tiny little bumps type things are growing on the skin. Anything with skin is related to vitamin A deficiencies. And guess what it takes to digest vitamin A?
Bile.
Bile.
Bile,
Okay.
yes.
So
And
bile.
I have SpectraCell actually, and I was and every year I've been doing it for the past 3 years, and I was just this last year when I did it a month ago. They said that I was borderline A deficient, which was the first time because all the fat soluble vitamins before were good, the D, K, A, but this time I was actually D was borderline and A was borderline.
Ding, 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 ding. So yeah, so skin is all about the fat soluble vitamins, and you always look to her the gallbladder that's digesting those, so she doesn't have enough bile. So with you, probably some apple cider vinegar plus before the meal, and maybe one gallbladder after to get the fat soluble vitamins in there, and the skin will be really nice. So vitamin A deficiencies create acne, bumps, little goose pimple bumps. Anything with skin is vitamin A, but most people get enough from the diet, they just can't absorb it. And guess what? All the remedies for the anti-inflammatory remedies are the omega-3 fatty acids. They're all fat related. So even vitamin D deficiency will cause pain. So again, it's a matter of that digestive system, getting that thing back. That's why a lot of arthritic type stuff and pain in general is liver, and it's connected to the gallbladder. So this is what we'll do. We're going to strengthen the gallbladder. You probably do a little bit of acupressure each day. This will totally be cleared, probably take maybe 2 weeks at the very most. And I think you can, and then you just have to keep your eating in. Just keep really standard. And then if you tend to want to cheat, have some healthy junk food without the sugar. But I think you're going to have to add a little more fat with the meals, which the gallbladder will help to allow you to go longer without eating. And because you cannot fix insulin resistance without fat. So but the problem is it might be hard to digest. So don't go crazy, just a little bit, and then gradually increase that. You'll go longer without eating. You drop insulin, you'll heal the insulin resistance. Your digestion will do better. So does that sound like a plan?
Yeah, absolutely. Yeah, that makes sense.
Okay. Awesome. Well, thank you very much.
Thank you.
Okay.